Are you dealing with a popping sensation or a clicking sensation in the front of the hip? In this video, I'm going to teach you why this might be happening and what you could do to fix this. What's up guys, Dr. Nick Bonforte. So what is this hip popping sensation in front of the hip? Maybe you feel it when you do a sit-up, or maybe you'd feel it when you're on your back and you're lowering your leg down to the ground and you get that popping, that audible popping sensation in the front of the hip. This is commonly referred to as snapping hip syndrome. So there's different categories of this. There's intra-articular snapping hip syndrome, there's external and internal hip snapping syndrome. So this one we're gonna be focusing on internal hip snapping syndrome. So to better understand this, we need to go over some anatomy. So this internal hip snapping syndrome is commonly a cause of the psoas muscle or the iliopsoas muscle, which originates on the low back, parts of the pelvis, and it goes down to attach to a piece on the hip bone. So this hip snapping syndrome is likely a result of when the muscle or the tendon snaps over a bony protrudence. So a bony aspect on part of a bone. So commonly what is blamed for is what's called the iliopectineal eminence. That's where the psoas muscle or tendon is snapping over that part of the bone and you get that audible click or that audible pop. There are other areas that could be to blame for this, but that's just one of the most common areas that is said to be the result of this snapping loud noise into the hip. So why does this happen? There are many causes to contribute to the result of this snapping hip syndrome. One of the most common causes is when there's a lack of stability in the abs and there's like a coordination or a motor control issue between the hips and the pelvis. So when you lack this coordination or the strength and stability between when the leg is moving and how well the core strength is or how well the pelvis stability is, when there's a deficiency between those, that can more likely lead to these hip snapping syndromes and that audible pop. So you might be thinking, well, what's the fix? How do you decrease this audible or this clicking sensation to the hip? So by doing this, we have to make sure we're focusing on the strength, the stability between the pelvis and the hips, or the core strength, the ab strength, and how the hips are moving. So we're gonna go over 3 exercises to illustrate this. The first exercise is simply just on your back doing ab marching. So with this exercise, you're on your back, you're making sure your low back is actually pressed into the ground. That will facilitate more core activation. At the same time, your legs are bent and you're just tapping one heel to the ground and bringing it back up, and then you're alternating. So likely with this internal hip snapping syndrome, the clicking sensation or this pop will happen when the hip is flexed and then going down into an extended position. So by working on this coordination and the strength and control of the abs, making sure they're turned on with this exercise and doing the motion that would likely cause this, if we do this nice and controlled and with a lot of focus, it can tend to decrease that snapping sensation and help basically make some headway on this issue. Also, you can do some progressions with this. If you're getting good at it, you're not experiencing that clicking, popping sensation, instead of just keeping the knee bent and tapping the heel down, you could then start to straighten one leg and bring it back, and then alternate between the legs. With the whole time, you're thinking of core activation and pressing the low back into the ground as you're moving the hips. This exercise is using a band to facilitate other parts of the pelvis muscles, such as the glutes. So if we're thinking that there's coordination issue between the pelvis, what attaches to the pelvis, the abs, glute muscles, and more, there's an issue between the coordination, the stability, and how the hip is moving, we have to activate other parts. So by using this band, we're placing it on the foot, we're pushing into the band, and we're gonna be lowering the leg or straightening the leg, emphasizing the glutes doing the job of this pushing into the band. At the same time, you're keeping core activation and stabilization as you're doing this. So again, this helps coordinate stability and strength with how the hip is actually moving. The next exercise is doing leg fallout. So we are on our back, we're keeping the back flat into the ground, which again activates the core, keeps it nice and stiff and stable. And we're taking the leg and we're bringing it out to the side until we start to feel the pelvis either shift or you're about to feel that popping sensation happen. So you go either A, right before the pelvis is about to tilt, or right before you're about to feel that sensation. That's when you would bring the leg back in. So again, we're working on this coordination between the pelvis and how the hip is moving. So leg fallouts, you go out nice and slow, and then you bring it back in, working on the coordination and motor control with this exercise. So there you have it, 3 exercises to help solve this snapping hip syndrome. Hopefully you found this video helpful. Guys, to really help out with the YouTube algorithm, it would be really helpful if you subscribe, like, comment, leave any questions or comments below, turn on your post notifications so you never miss a video. This is Dr. Nick. I'll see you next time.